to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Dr. Anna Cabeca, speaking on hormone balance and its mood connection. Dr. Anna Cabeca is a board-certified gynecologist and obstetrician, as well as board-certified in anti-aging and regenerative medicine, an expert in functional medicine, and an expert in women's health. She specializes in bioidentical hormone replacement therapy and natural alternatives, successful menopause, and age management medicine. Dr. Cabeca earned her medical degree from Nova-Southeastern University of the Health Sciences in Florida. Since completing her residency at Emory University in Atlanta, Georgia, she has maintained a private practice in Southeast Georgia. Dr. Cabeca frequently lectures nationally and internationally regarding restorative health and women's health issues. She is a consultant and trainer for other physicians in bioidentical hormone replacement therapy and functional medicine principles. A mother of 5, Dr. Cabeca is a native English speaker who is conversant in 4 languages. Growing up in a multilingual and cultural household nurtured her love for international medicine and travel, which she pursues to this day. She has traveled around the world learning healing modalities from leading physicians, scientists, and other practitioners across Asia, Europe, the Middle East, Africa, and South America. Her belief is that the advantages of creating health and hormone balance are that we not only improve our own health, but also improve the health of our generations to follow. She is the co-creator of the Sexy Younger You Telesummit and the creator of the highly acclaimed virtual transformational programs, womensrestorativehealth.com and sexualcpr.com. For more information, please visit her website at cabecahealth.com. Welcome, Dr. Anna Cabeca, to the show. I'm so excited to have you on today.
Oh, it's a blessing to be here, Laura. Thank you so much for having me.
Yes. So today we're going to be focusing on hormone balance and its mood connection. And I'd love to start off with just talking about what inspired you to specialize in bioidentical hormones and natural alternatives for women's health.
Absolutely. Well, I would say that I grew up with a food as medicine culture. I always joke and say I grew up in the United Nations with family from around the world visiting us, and just the sense that what we need to do will heal, we have in nature to help our body heal itself. And when I went to medical school, I went to an osteopathic medical school with that in mind, empower the body to heal itself, using manipulation as you do and alignment and the importance of understanding that. And always a big proponent for women's health, especially with my own strong family history of heart disease, and then finding out that there was little research to base the medical and pharmaceutical treatments that my mother was undergoing in this country. There was no research on women, and that was a big eye-opener for me. So like many of us young and ambitious, we're going to change the way it's done in the world, right? And so I went and I specialized in women's health and gynecology and obstetrics at Emory University in Atlanta, which was a fantastic experience. And I came through medical school, et cetera, as a National Health Service Corps scholar. I was really blessed to receive a scholarship to pay for my medical school. And so in return, I came to an underserved area here in Southeast Georgia and began my practice thinking, okay, well, I've got the best education. I know it all. And one of my first patients to come into my practice was a 63-year-old woman who was a CEO of a biotech firm and had traveled to see me. And she said, I am a woman of the 60s. I had DCIS of the breast, this ductal carcinoma in situ of the breast. I was told I can never be on hormone replacement. My vagina is as dry as the desert. I don't want to have sex. And yet that was a big part of my identity and our relationship, her relationship with her husband. And I don't want to live this way. Doctor, fix me. And I was like, whoa. Next. No. So I looked at my doctor's bag. And I looked and I couldn't find anything to really help this woman. So I did what I do, and that's research. I was a researcher before I went to medical school as well. And so I looked at the research and I said, well, what can I do to help her restore her vaginal health, libido, sense of drive, and that's what really spurred me on. It's one patient after the other looking for the answers and doing it from the holistic perspective. Okay, what's in nature? What was divinely designed, and how can I use that and all of the benefits of Eastern and Western medicine together to help someone honor their body's design and reestablish that connection not only to their feminine and masculine energy, right, to their sexual energy as well, but to their partner, to reestablish, reigniting the connection with their partner. And so that drive has been entirely possible only through bioidentical hormones. Nothing synthetic has ever shown any benefit to my clients in any way. So I really have found that this has been an incredible route. And then as well, being a practicing physician in a small town as an obstetrician with very traditional roots, was looking at, okay, what can I do that, for clients, that if they, what's a safe in pregnancy as it is outside of pregnancy, right? And so understanding that, why would we treat our body, the standard improves when we're pregnant, right? So when we're pregnant, we're like, okay, I'm going to do this for my baby, what I wouldn't necessarily do for myself. And then really promoting that sense of holistic natural health. Like, if I'm not going to take this, or I'm not going to eat this or take this medication when I'm pregnant, why would I want to do it outside of pregnancy? Really, that just makes sense, Laura, doesn't it?
That completely makes sense.
So I had the benefits of that type, thinking, okay, well, what can I do that's holistic and natural and beneficial to me, to my clients, and to the future generations to come? And how can we do that as naturally as possible?
Mm-hmm. Wow, it's really awesome. So I don't know if a lot of women listening are aware, like, because you were mentioning hormone replacement therapy, they actually are using horse urine is where they're getting the estrogens from, right, to create those synthetic hormone replacement.
Well, there's a few different, there's definitely, you can get bioidentical estradiol from many pharmaceutical brands, and the delivery mechanism has been patented, or you get, a generic estradiol in a pill form, or you can get it in a patch form or a vaginal ring. So there is bioidentical estrogen we can get called estradiol. What you're referring to, Premarin, is the one that had been very widely dispersed, and that's where the Women's Health Initiative study had looked at Premarin and Provera, which is Premarin is from pregnant mare's urine. That's where they got the name. And Provera, which was a synthetic progestin. So it's not a bioidentical progesterone. And the reason that this, we would say with thyroid, we test, right? With diabetes, we test, right? We look at glucose, we look at insulin. But with hormone replacement, we were just throwing at people. No one was testing. Well, what are their levels? What's normal for them? Because you can't test for Premarin. You can't test for progestin. They're not working in our system the same way. So hormone testing wasn't developed. It was, was used. So there's that aspect. Okay, if we test for someone, and this is where it makes perfect sense, we can look at the medical perspective and say, well, if we're testing someone's estradiol or total estrogen, and then we put them on a synthetic combination, will there be a change? And there may be a small change, but we're not going to see the impact because the percentage of hormones we're testing for, say in estrogens, we're looking at E1, E2, E3. We're looking at a lot of conjugated byproducts in the Premarin that aren't being tested for. So, and how does it work in our system? I still don't know. I've looked at the research. So that's one of the reasons why testing wasn't, really practiced or understood until we started using bioidentical hormones. And certainly hormonal testing in and of itself is an art form.
Right. You can do it through blood or urine.
Saliva.
Yep. And so
different ways tell us different things.
Right. And they're also going to have they're not all going to show the same information.
Mm-hmm.
So in your practice, how do you typically test for a woman's hormones? Are you doing it through blood or another way?
So typically what I would do, depending on, of course, it depends on the patient, the circumstances. Are they on medication currently? Are they on bioidenticals? And if they are, is it orally absorbed, vaginally absorbed? Is it through the skin? Is it a pill in the, that they're swallowing? So all that comes into the clinical decision making for sure. But typically when I have a patient who's come in and they're not on any hormones or they had a hormone holiday or a medication holiday, what I will check is quickly the blood, because I get those results back very quickly, and I'll look and see and get a gestalt, because not only am I looking at her blood work, I am looking at a 14-page history and a patient in front of me. So, so a lot comes into it. But I tell patients right up front, I say, we will pretty much test every body fluid that you have, whether it's your urine, your blood, your saliva. We're gonna hit it all at some time during our management. And again, for many of us, the way I would prescribe hormonal therapy would be different. For example, one thing that I think is early on, our hormones start to shift in our 30s, mid-30s, 35 to late 30s. We start to see a decline in progesterone, or more of an estrogen-dominant type of scenario where we have PMS, irregular bleeding, irritability, mood changes, breakthrough bleeding, cramping that may be worse with the menstrual cycle. And so we start to notice these cyclical changes. So using progesterone on the second half of the cycle from ovulation till menses bioidentically is great. And I use a formulation that progesterone pregnenolone combination, because I find that we want to protect our memory and our brain and support all our hormones. So I use progesterone and pregnenolone in a cream. That's my Pure Balance cream. It's a progesterone pregnenolone combination cream, and using it topically is nice in the evening because it's also going to help us get a good night's sleep. And that can help with that balancing. But always, as you talk about with your clients, is we want to make sure that our food is, our food is healthy. We have a more of an alkalinizing diet. We are eating whole foods, et cetera. So the lifestyle is all being addressed at this time as well.
Mm-hmm. Yeah, it's so important. And that's what I love when I speak to other holistic-minded functional medicine doctors, is they all mention lifestyle. It's not looking at a woman and her hormone levels and then just treating her hormones. It's looking at the whole person and recognizing her stress level is going to impact her hormones, her exposure to toxins in the environment, her diet, if it's processed, if it's GMO, all of these, and how much she moves her body. All of this really impacts how her body is making hormones and storing hormones and eliminating hormones.
So true.
Mm-hmm. So I think that's really helpful. Recently I had another episode with Dr. Wacharski, and he was speaking also on using progesterone cream with women in their late 30s that were wanting to conceive, and, for perhaps having any fertility challenges, it helps to maintain the pregnancy, especially that first trimester, because that can be a common cause for miscarriage for older women wanting to get pregnant. And he said that the levels are so low that even though her body's making a lot more progesterone during the pregnancy, you can safely stay on it and even help after the birth to prevent like a big dip with postpartum depression hormone issues.
I think that progesterone is an overlooked antidepressant, certainly, especially when it comes to postpartum depression. Our babies swim in it. I think feel very strongly. Again, low amounts can go a long way. Small amounts can go a long way. But helping a mama get a good night's sleep and not worrying about an SSRI or other pharmaceutical causing problem in the baby. So certainly when there's a need, it's necessary. And in my clients who have had fertility treatments, et cetera, I recommend that there's no off time with it unless I've really got some great systemic levels and everything's fantastic. So I would agree and have also used progesterone postpartum for postpartum depression. I think it's excellent.
Mm-hmm. I would love for you to maybe speak a little bit more about that, actually, about For example, we all know that women's hormones are impacted by pregnancy, and certainly after giving birth, there's changes in hormones as well. Can you speak a little bit more about what's occurring and how a woman can preventively kind of help support her hormone balance as healthy as possible during pregnancy and after birth?
Yeah, absolutely. And I think a big part of that is the therapeutic lifestyle changes, right? So giving yourself a lot of TLC, therapeutic lifestyle changes, tender loving care. So just remember TLC. And that's about filling your tank first, especially as a pregnant mama. So nourishing your baby, your awareness is heightened by what you consume is going to affect your child. So all that comes with detoxing, drinking out of glass bottles and having filtered water and eating whole foods that are organic and, the slow food movement. So foods that are grown close to you and that are as fresh off the vine as possible whenever that's possible is really empowering to your hormonal status. And then nutrient supplementation during this. I had created a series of laboratory tests with a company called Metagenics, which is now Genova, called the Women's Health Profile, which looks at functional analysis. It looks at your organic acid. It looks at how, no matter what you're eating and supplementing with, what does your body, where could your body need more support? Or is there too much of a toxic burden, or do you not have enough healthy bacteria? What can we do to optimize you during pregnancy? Also, are you at risk for preeclampsia? And I look at ADMA for that. I look at, peroxides. I look at organic acids and detoxification markers. So it looked at all of these things. I compiled this into a test so that we can be armed with this, and it's called the Women's Health Profile. I think that's definitely useful for your physician to order or to look at, to understand. Again, it can be an overwhelming amount of information, especially if you're not familiar with it. But so, a healthy balance of really having bioidentical vitamins, because there are synthetic vitamins that we're writing as prenatal prescriptions, and they're not correct. It's not correct. Or we wouldn't have such a high level of autism in this country, right? I mean, what are we empowering our immune system with and our baby's immune system with, and et cetera? So I look to the name brands who I use for probiotics are really highly sourced, beneficial, natural nutraceuticals, and the same with the vitamins, the pregnancy vitamins. There's a lot of good work out there by Dr. Ben Lynch, who has been very profound in bringing MTHFR awareness into our nation. He's done a great job with that, but looking to see, are we good methylators, bad methylators? And if we're taking folic acid, we're not doing ourselves nor our baby any good. We need the methylated form, and that makes a big difference. So using these types of things will make a difference. Some methylated vitamins, albumin micronutrients, chelated minerals. That should be the type of prenatal vitamin we have. And there are a few that are my favorite, certainly. And you can advise your clients on those as well. But, I prefer also a very clean source of DHA and EPA, that we're looking at really good omega-3s, that we're not getting them from Costco or Walmart, and they're, the end of the line cheap source that could be heavily contaminated with heavy metals. And that was honestly, Laura, one of the things that really drove me into my, carrying my Vita Pure line of supplements, was because as an obstetrician, I'm recommending omega-3s. And then there was a pull from one of these name brand companies that had to pull their omegas off the shelf because of high levels of heavy metals in testing. And that freaked me out. I was like, what? That was a big eye opener. And that took me back again to my research background, said, okay, where is it sourced? What's the purity testing on it? If I can't, I'll recommend the gold standard. It's certainly up for the individual to choose what they want, but at least I know that I'm going to recommend the gold standard. What I recommend is of the highest quality, and is going to be as free from harmful agents as possible. So that was a huge eye opener for me in treating my pregnant moms with vitamins and fatty acids, omegas, et cetera. And it is so important that we understand that, because nourishing our body with adequate B vitamins and adequate omegas and healthy fats, and that we have adequate levels of vitamin D, it's super important. And with that, some of my favorites, especially we were talking about postpartum depression, if we're at risk for anxiety, mood disorders, depression, and pregnancy, that's where we're going to add on some extra bioidentical B6, some HTP, tryptophan, 5-hydroxytryptophan, and I may go 50 to 100 to 200 milligrams of that. And, make sure the vitamin D level is really optimized, that we've got a good source of iodine in the system, that they're either eating some Brazil nuts for natural selenium, or we're supplementing with a combination of maybe a methylator and selenium to help prevent postpartum depression. And then if I need to, I will, or even intra-pregnancy depression, if we're at risk or if someone was on a medication before pregnancy and we needed to get them off them, I would do the same thing. And I think that's a really big underserved area, because in pregnancy, one of the, we have classifications A, B, C, D for what are we able to take in pregnancy. And if someone was on an SSRI like Prozac or Zoloft, et cetera, it's category C. And as much as the pharmaceutical companies would like patients to continue that during pregnancy, it's against our recommendations, although there was a big push to say, well, if they're on it, don't change. They're doing well, don't change it. Because our next source to change to a category B is Wellbutrin, which works on a different mechanism altogether. But if we support the underlying reasons for the neurochemical imbalances by using this regimen I talked about, B6, 5-HTP, vitamin D, iodine, selenium, we're going to go a long way with improving overall outcome and actually rebuilding our own neurotransmitter stores versus relying on something that's going to block our receptor sites and potentially damage the fetal receptor sites as well. So that tirade that I've been on is I'm really passionate about generational health.
Right. I mean, and it's so true, like, generational health, like, what does that mean? I think now what we realize is, when a fetus is in utero, a little girl, her eggs are already fully developed by the time she's born. And so therefore, a mother is directly impacting her grandchildren's genetics through the pregnancy and what that baby is exposed to and as it's developing. So we have to, I think there's still a lot we don't know regarding utilizing certain pharmaceuticals during pregnancy, like you mentioned, and, tryptophan is a precursor to serotonin, so it just makes sense that we would want to supply the body with what it needs to make its own hormones, and there's also a lot of production in the GI tract, right? So in other words, if the GI tract's not functioning normally, then it's hard for the body to make vitamin D and to make serotonin, and that's really that's what ideally should be getting addressed, is supporting normal, healthy gut function.
Absolutely. Yeah. Healthy probiotics, fermented foods, fermented vegetables, and, it does make a big difference. And it matters us. We talk about vaginal birth over cesarean birth, because through vaginal birth, we get inoculated with our maternal, the healthy bacteria from our mothers. And that is crucially important, we know now, to the development of our own healthy microbiome. And in fact, I read recently about a obstetrician performing C-sections and then inoculating the baby with the mother's vaginal fluids to, just to massage the baby with the mother's vaginal fluids as if they had come through the birth canal to increase their own natural probiotic exposure, which is, again, hugely important.
Hugely. A few episodes ago, I had Dr. Eden Frumberg on, and we spoke in depth about ideally putting a swab, gauze in a woman's vagina even before they administer the antibiotics and other drugs for the cesarean, so that bacteria is preserved to swab the baby with after the birth. And it makes a big difference. We see how that can impact the child's rates of asthma, allergies, essentially the 4As, ADHD, autism, all can be connected to that child's microbiome, which is developed during going through the birth canal, the first exposure. So, yeah, so important. And, it's one of those things where we were joking, like probably, 10, 20 years from now, it's going to be standard that every woman who gets cesarean, their baby will be swabbed with her, vaginal flora. But unfortunately, it's not standard of care at this point, and it's something that, is rare. And a lot of times women are having to actually request it and kind of fight for it if they are needing a cesarean section.
Well, and this is where your blog is and your podcast is so important, because making women aware, it's like, okay, if you don't need to swab my vagina with betadine before we do this delivery, please don't. I'm clean. I'm with my husband. I don't have any STDs, been tested in pregnancy. We're at no risk, and I will default to deferring. Don't swab don't HIPAA cleanse or cleanse my vaginal tract. It was designed for naturally to inoculate the baby, and we are trained to create a sterile environment, which is in opposition to nature in this instance. Mm-hmm. Now, if we have a client who's been repeatedly with chlamydia, gonorrhea, STDs, herpes, et cetera, we're going to discuss this differently. But our majority of our clients are very conscientious of this fact. And so, what are we treating chlamydia in the eyes of an infant if the mom's never had chlamydia for? Right? The first antibiotic that they're exposed to is within minutes of life from the eyes. So let's think this through, think our procedures through, and don't treat the majority like the exception. So let's look and see who are we treating, what is the consent forms, what do we need to, when do we need to swab or cleanse the vagina with betadine, et cetera.
Mm-hmm. Yeah,
and we test everyone in pregnancy, regardless. And if they've come up, it's just that understanding. Okay, well, what are our actual risks versus the consequences of a prophylactic, supposedly preventative intervention that may not be necessary at all, and how, as I, as their mother and father, can determine that, right? It brings me back to the work of Ignaz Philipp Semmelweis. So it's kind of like the tides have turned. Ignaz Philipp Semmelweis was an Austrian obstetrician and worked at the teaching hospital. And what he noticed that the midwife hospital had many less deaths, significant less deaths than the teaching hospital. And he observed that the teaching residents would come from at the teaching hospital, the residents would come from the autopsy lab, do a delivery, and there was no hand washing. And his basic thing was just wash your hands. And he was pretty much ridiculed and driven into senility from that simple statement. The Austrian medical community dismissed him, told him he was insane. You think we're dirty was their initial response, right? And he's like, I'm just saying, wash your hands. Right? It's like, just wash your hands. It's the simplest thing. And now we've gone to sterilizing the entire process, and the pendulum has swung too far. So it's pretty amazing to look at that and just think, okay, there's a happy medium here. We need to treat each couple, each child coming through the birth canal with the utmost respect that we can. I think that's really important.
Oh, I completely agree. And it just makes sense. Like, we are still kind of in our infancy to understanding the microbiome and how it impacts our life. But we do know now that we are more bacteria than we are human cells. And that's also important to have that awareness of how, this bacteria, viruses, yeast, and parasites that are living in our body can be helpful and necessary for our normal body function. So, killing all the bacteria is not always a good idea.
So true.
Yeah, it is. So in your bio, we mentioned how you had grown up in a very multilingual cultural household. And I would love for you to maybe share how your passion for international travel has impacted how you practice medicine, like from different cultures, how you brought that into your practice in Georgia.
Yes, absolutely. So, many years back, I took a sabbatical from my medical practice and actually traveled a year around the world with my family, and a healing journey. Certainly for us, it was a healing journey. And from that time, I worked with and I studied under healers from some of the most amazing traditional methods, right, handed down through centuries, and also some of the world's leading physicians and medical persons, individuals or doctors or other specialties that from the highest intellectual institutions in the world. And so I was really blessed to have those experiences and to see in my search to heal myself, heal my family from our trauma and our experience, what had happened with us, and this healing journey. I found so many natural ways to heal myself, as well as perspectives to take, foods to eat and ingest, and looked at these traditional medicines, like, for example, maca in Peru, that is only grown above 11,000 feet, and it's been used as an incredible adaptogen to help support our adrenals, to give energy. It's called the Peruvian Viagra because it stimulates nitric oxide and hence the beneficial side effect, erections in men, but certainly orgasms as well. And so the beneficial use of that plus other things. And I actually formulated a product called Mighty Maca, which is 42 ingredients of the world's superfoods, and that combined to support hormonal balance, adrenal fatigue, and inflammation naturally, to work on all those pathways in this combination. It's been really, I'm always amazed at the testimonials I hear back. Now we have it recommended by over 15 medical specialties, and it's in over 30 countries, and I'm just blessed and think from my healing journey and my own personal struggle and a look for answers and to understand the research, and that this helped me and my family in so many ways, and gave me the information to look as a very open-minded way. I was already pretty open-minded, but to look and say, okay, well, there's a lot more that we can be doing here, and using it to help support for energy, certainly, for athletic recovery, certainly, but also for adrenal fatigue in patients who have had cancer. I was in my office this morning, and a woman stopped in and she said, I've been out for a few days and I totally missed it. She said, when I was having hot flashes, my period was irregular, and within 2 weeks, everything straightened out on Mighty Maca. She goes, I'm not going without it. And I just love to hear these testimonials from so many, for so many people. And even one of my clients, Mindy Jones, you can see her stuff on Facebook, a great athletic trainer. She says, she has her Mighty Maca babies, just supporting the adrenals, helping detox the body, helps to support the essence of fertility. Fertility for sure.
Yeah, I use maca a lot in my office, and it is very powerful because in general, a lot of us suffer from adrenal fatigue. We just are in that fight or flight, go, overwhelm, especially women. We want to take care of everyone around us, and it will really wreak havoc with hormone balance. And I think to this point, it's not just sex hormones even, but it's all the hormones of the neuroendocrine system. So the thyroid hormones, adrenals, pancreas, ovaries, and hormones coming from the brain, the hypothalamus, pituitary. It's all part of that neuroendocrine system, and maca, along with, other powerful herbs, can really help with lifestyle changes too, of course, but they all work together to help the body heal And it's so powerful. And if people are interested in learning more about your Mighty Maca, they can check that out on your website at cabecahealth.com.
Mm-hmm. And mightymaca.com as well.
Okay, great. So that's cool. So you learned about that. And what other type of like indigenous, health did you learn from other cultures and tribes?
One of I was just actually brings me tangentially, Dr. Laura, once again, but I was riding, horseback riding this morning, and it reminds me of when I was in Indonesia and I met with a traditional healer there. Again, it was serendipity. I just say God's hand was in this healing journey for sure. But one thing that he explained to me, like, I had tried at that point to conceive and failed the highest dosages of fertility medications that were even considered safe to take. So, it was really devastating. Felt that I was told also, as well as I'm a gynecologist, Emory trained, that I had complete and permanent ovarian failure, premature menopause, and this was irreversible, and there was no way I'd be able to have another baby unless I had egg donation. I was 42 at the time, 41. Mm-hmm. And so what he said to me, he said, I said he was doing his traditional healing methods. I was watching him with my husband at the time, and then he laid hands on me and he put his hands on my head, and the very top of my head felt very tender. And I was like, oh my gosh, what's that mean? He said, you worry too much. And I was like, well, of course I worry too much. Said, no, you worry too much. You have to be at peace. Let it go, And then he said, your ovaries are perfectly fine. And I said, no, my ovaries were shriveled up. Because your ovaries are fine, and that really did make me look at so many things differently, from with my, ultrasounding patients and working with patients and understanding the entire stress response system. But one thing he said to my daughter, who was at that time 10 years old, and looking at him intently, he asked her, he said, well, what question do you have for me? And she said, well, how do you talk to animals? And he said, look into their eyes and breathe. And, as I had done that with my horse this morning, and just thinking about that with people, with an intimate relationship with our spouse, holding that connection with our eyes, smiling and breathing. So I created this mantra that I want everyone to write down and practice. And it starts with pause and smile, breathe deeply, and connect. So you look into someone's eyes, pause, smile, breathe, and connect. So remember that mantra. That is incredibly beneficial, and that leads us to an increase in oxytocin, like a long hug, holding a hug with our spouse, holding a passionate kiss, and allowing oxytocin to naturally increase, getting in touch with our playful self, right? Playing with our kids when they come home from school versus going right to the homework and everything on our to-do list. Playing with our dogs, taking time with an activity that we really enjoy doing, and allowing oxytocin to increase naturally so we can refill our tanks is critically important. So I have to many times remember this mantra myself and say it over and over again, but pause, breathe, smile, connect, and take the time to really be present with who you are with.
Wow, that is so beautiful. And I can see why that would be so valuable for women that are so stressed about getting pregnant. There can be such a stress component when there's been challenges or miscarriages, or, even in your case, you already had, children, but you were wanting more, and there was challenges getting pregnant, and that really will impact fertility. We know that stress will interfere with the ability to conceive. The body is so intelligent, it's sensing that it's not a safe environment for a baby to come into the world. And so, I think a lot of times it's hard to know how to break that stress connection because there's such a deep calling to become a mother. And, but yet the body doesn't appear to be cooperating. And it's really about, like you said, just breathing deeply. And that's the letting go. That's the surrendering component. And I think it's so important for us to remember that.
So true.
Yeah, we all need to remember that. I'm like, I need to breathe.
Absolutely.
Yeah, for sure. I would love for you to, maybe speak a little bit more about maybe a case study from your actual practice of how you've helped a woman with successfully, balancing hormones. And I mean, maybe, you shared a little bit about your own story, but just a woman who was, told she would never be able to get pregnant, and then you were able to help her conceive a healthy baby.
Oh, yeah, absolutely. And also want to give your listeners a link to my Feel Fabulous web jam, because it goes through my story even in more detail, as well as a couple of clients that I've worked with, and really it will inspire hope in even the most downtrodden of us, and those that are already doing things that are at 100% capacity may find another aha moment in there as well. But it's at my website, cabecahealth.com, and /Feel Fabulous, and it's a free webinar that I have, which is excellent. But one thing, I've worked with a client, and her name is Mary Ann, and her video is also featured on my website. One thing that Mary Ann, when she had come to me with her husband actually dragged her in to see me, basically said it pulled her up off the couch. She'd given up. She'd been diagnosed with breast cancer 8 years prior, was over 300 pounds after her breast cancer diagnosis and chemotherapy and several rounds of chemotherapy. She then continued with hormonal imbalance and had a hysterectomy, and had even stopped seeing the oncologist because she felt like, I was just waiting for the next shoe to drop, and, I feel miserable and there's nothing they can do except say, well, you're alive. She said I was alive, but I wasn't living. And she really just felt at that point that she'd rather have had her husband, he needed to find someone else to be happy with because she was miserable. I mean, she did not want to live anymore. That's the desperation she got into. And when she came to see me, I could see, I was looking, this is how, as functional medicine docs, we look for the underlying issues. So what caused the hormonal imbalance in the first place, breast cancer in the first place? Why then did she need a hysterectomy? And, what were, anything along the way, what is her, mitochondrially, is that a word, mitochondrially? I just made that up. Through her mitochondrial metabolism, right? Is she, say genetically, but it's really the mitochondria that we weigh heavily on, more so even than genetics. So what was going on there that I needed to support? And honestly, I mean, she followed my program. We had her on a Candida program, so very low glycemic, program. I worked to balance her hormones naturally, definitely used the Mighty Maca greens, and worked with other nutrient support, including just, healthy levels of omega and krill oil, and worked on that way, as well as my head to toe approach. It's mind, body, spirit in a very head to toe way. Okay, let's look and address these things. And we did. And you see the amazing difference. She lost over 130 pounds. She happily celebrated her 30th wedding anniversary, just totally with a twinkle back in her eye. Her husband said to me, it really brought tears to my eyes. He goes, "Thank you for bringing my bride back to me." And she rode a 100-mile bike ride across Georgia. She's become this long-distance cyclist, which I can't do that. And, and she's, really, truly amazing. And what she said, she goes, "Thank you for giving me my smiles back." When it comes down to like how we look, how we, what we have in life, it's the enjoyment of what we are giving us. Yes, she's had a history of breast cancer, history of recurrent breast cancer, and she has her smile. She has enjoyment for the life that she has. And that's where this powerful balance and natural medicine comes into play. We must look at the mind, body, spirit altogether and remember that the temple is the house of our spirit. The body is the house of our spirit. And so, keeping our body energetically optimized is critically important to our spiritual energy and joy in life. And I want to encourage anyone listening that no matter where you are now in your life, with your age, with your past experience, you can completely transform so that we're not surviving or just living or getting by. We're absolutely thriving and we're living our purposes out in a enjoyable way, connected with each other, and that's a gift.
Well said. I completely agree with that. Like, life is meant to really fully enjoy and thrive. And, no matter where you're at, there's room for baby steps to move towards the next level of health. So thank you once again, Dr. Anna, for coming on the show and sharing your wisdom. I really appreciate it.
Oh, my pleasure. Thank you for having me. And I wish you and all your listeners lots of luck, joy, love, and connection.